Thank you for tuning in to Wednesday's edition of COVID-19. I'm Min Sun-hee. Korea's city of Gwangju has recorded 130 cases of the virus as of this morning in a span of 11 days. Meanwhile, the United States has formally announced its withdrawal from the World Health Organization. And speaking of the global health body, officials there are now acknowledging emerging evidence of airborne transmissions of COVID-19. We start the program now with our Kwon So-ah and Kim Dami. So, let's begin with the domestic updates then.
Yes, Sunny. Well, today we have a concern as we have a rise in both local cases as well as imported cases, which amounted to 30 and 33 infections respectively. And that brings Wednesday's total cases to 63 new infections here. And that raises the total accumulation to 13,244. The death toll remains unchanged at 285, while 989 people remain in quarantine and 11,970 people have made a full recovery as 56 more people have been discharged from hospitals or treatment. Now, following a 3-day decrease in daily cases, as we can see here, from 59 to 48 and 44, we are back to the 60s. And in fact, that's the same number that we saw over the weekend. And health authorities assessed that there are more cases linked to small gatherings than to bigger gatherings or bigger facilities. And that can be seen in our map here, on our map that is, as many cases are now scattered across the country instead of having a major outbreak in just one region. But still quite a lot of cases in the metropolitan area, with 18 in Gyeonggi province and 10 in the capital Seoul. And other places with quite a rise are here in Chungcheongnam-do province with 6 new cases, as well as Gwangju with 8 new infections. And now let's move over to the global updates. We have a total number of 11.94 million cases across the world, and that as over 200,000 cases were added in just 24 hours. The death toll stands at 546,601 as of noon Korea time, as almost 6,000 people have lost their lives in the span of a day, and 6.89 million people have now recovered. Let's move over to the major outbreaks. The U.S. has more than 56,000 new cases, 48,000 new cases in Brazil, and 23,000 new cases in India. That brings the total to almost 3.1 million in the U.S., 1.67 million in Brazil, and 743,000 in India. And Russia is also still having around 6,000 new cases on a daily basis. That's why it looks like Russia soon will also surpass 700,000. Peru and Chile similar at 300,000. And Chile actually surpassed Spain if we go over to our next table. Spain now has some 299,000 cases. And still, although it's not a hotspot anymore, it is still adding some hundreds of new cases on a daily basis. That's why Spain is also soon predicted to hit the 300,000 mark. Meanwhile, Iran, Italy, and Pakistan between 234,000 and 245,000 cases in total. And those are the figures I have for now, but I'll be back with more updates after the government briefing. Until then, back to you, Sunny.
All right, so thank you for that for now. Right, in some countries, those receiving COVID-19 treatment can rack up huge hospital bills. But for people getting tested and treated in Korea, money, it's not an issue. For more on this fortunate reality, I have our Kim Dami here in the studio. Welcome, Dami.
Good afternoon, Sunny.
Right, Dami, let's begin with the actual treatment cost of COVID-19 here in Korea. How much does it cost?
So, Sunny, it costs about $4,000 for hospitals in South Korea to treat each COVID-19 patient. And for those with severe symptoms, it can cost almost $11,000. And despite these figures, Korean citizens don't need to worry about how they can afford the treatment, because the national health insurance covers 80% of the costs, and the central government takes care of the rest. I actually had a chance to talk to someone who recovered from COVID-19 recently, who paid just a couple of dollars during her entire treatment process.
After getting infected, so it was even more stressful. But I didn't need to worry about the direct financial costs. I was able to focus on getting treated, and I think that's why I was able to recover quickly.
Right, now that must have been a huge relief for her and of course for all those other Korean patients who are battling COVID-19. Now tell us briefly about the nation's health insurance. How does it work?
So national health insurance schemes generally work in two ways. So national health insurance, also known as NHI, and social insurance. NHI systems are operated by the government and funded by tax revenues. And that means that doctors are employed as public servants working for a state-run hospital. Under social insurance, health insurance fees are collected from employers and associations and also by region. And South Korea merged its state insurance funds into a single nationwide insurer in 2000. And 20 years later, the National Health Insurance Service is playing a key role in providing affordable care to COVID-19 patients.
Tell me, what's the situation like in other countries? How are the other countries dealing with COVID-19 testing and treatment for their people?
Right. So countries like Taiwan and Germany have also successfully tamed the virus with their own unique healthcare systems. And actually, Taiwan provided its people with free face masks. But not all countries were prepared for a pandemic. In the United States, 8.5% of its population are uninsured. That's almost 28 million people. And some Americans even avoid visiting the hospital even when they're seriously ill because they have to foot a large medical bill out of their own pocket. It is free for Americans to get tested for the virus, but treatment costs must be paid for by the patient either through their insurer or by themselves. The global COVID-19 caseload now stands at 11.7 million, and the U.S. is largely contributor to the grim milestone with over 3 million cases.
Right. Now back here in Korea, aside from the national health insurance system, I understand the country's medical system was relatively well prepared for global health pandemics compared to its counterparts worldwide.
Definitely, and national health insurance takes care of all citizens and their health records. So it really helped treat patients in a transparent way, like determining what other symptoms they may have and what medications they take. Plus, as you can see in the graph, South Korea's healthcare system was well equipped even before the pandemic. The US, Canada, and India had fewer doctors and hospital beds per capita than most other developed countries. On top of that, the US healthcare system, for instance, is a mostly private for-profit system. So when COVID-19 patients were in desperate need of medical help, some of them fell through the cracks.
Doctors and nurses in the U.S. have been laid off since February because hospitals were struggling to survive. So medical workers were all at home when they were needed the most.
Right, that is really quite unfortunate.
Right. And South Korea's national health insurance certainly wins its praise for its role in containing the virus. And on top of the country's 3T system, that is testing, tracing, and treatment. And let's take a listen to another expert's comment on how it actually played its role in containing the virus.
When Daegu saw a spike in cases back in February, public hospitals treated 3/4 of the patients. So that really shows how crucial and necessary public medical care is in emergency situations like the pandemic.
In addition, the South Korean government provides a 50% discount over 3 months on health insurance for those in lower income brackets and special disaster areas. And for other areas, 20% 3-month discount for those in the lower 20% of health insurance fees.
All right, Tommy, thank you for that. Hopefully I'll speak to you again soon.
Speak to you soon.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19. Now, despite the recent rise in cases in the cities of Gwangju and Daejeon, which were previously considered relatively safe zones, health authorities are dismissing the need to raise the entire country's social distancing level to 2, adding that the current caseload is within Korea's medical capacity. Officials have also put to rest concerns over the possibility of imported cases triggering community spread spreads by pointing out that the cases have so far been detected at the airport or while under the mandatory 2-week isolation upon entry. Meanwhile, a total of 46 students and 10 teachers have tested positive for the virus since the reopening of local schools in Korea starting from May 20th. In response to this reality, there have been renewed calls for the wearing of face masks on public transportation, as the majority of these young scholars opt for these forms of commute. Health officials have also been calling for proper indoor ventilation to stem the spread of contagion and for practical personal safety precautions when dining at restaurants. Now, these precautions include the refraining from conversation while eating on the part of the diners and a different sitting arrangement on the part of restaurant owners to reduce the risk of airborne transmission. Also, in related news, health workers have so far administered remdesivir to 22 patients in critical condition, while more than 300 fully recovered patients have volunteered to donate their blood plasma for treatment and research purposes. We are still waiting for the briefing to commence, and while we do, perhaps we can take a look at the everyday life quarantine measures for those in the country to stay safe. Now, do remember to stay home for at least 3 to 4 days if you find yourself feeling sick, and do get yourself tested should you believe you may have been exposed to the risk of contagion. Also, keep your distance from those around you when indoors and outdoors, and wash your hands for 30 seconds. Cough into your sleeves. Now, these are the practical personal safety hygiene measures that you can take to protect yourself and others around you. Remember to ventilate your rooms or your places of residence as well as work to ensure that the flow of air there is healthy and proper, especially if you're using the air conditioner. I understand that the briefing will start right now, so we will come back to you afterwards with a summary of the key announcements.
First, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of July 8th, we have 30 new local infections and 33 new imported cases. And the total number of confirmed cases now stands at 13,244. 56 more people have been discharged following full recovery, and about 90.4% of the total have been discharged, and a total of 989 people are in quarantine. No change in the death toll as of yesterday. And here are some updates on our domestic infections. At an office building in Gangnam-gu District, Seoul City, we have one more confirmed case. And we also had 4 infections with unidentified sources of infection. However, they were categorized under this case, and a total of 11 cases have been confirmed. And at a door-to-door facility at the Metropolitan City in the Gyeongsang, as well as the Wondang Church in Goyang, we have accumulated case of 30. And also at the Daegu Seogu District door-to-door facility, we also have additional cases, and the total now stands at 87. And also we have the case door-to-door facility in relation to the Gwangju City, and this is in relation to the Gwangnuksa Temple, and we have 3 more cases, and the total now stands at 95. Out of the new cases, we had those imported, regarding the sauna as well as the Gwangnuksa Temple itself. And also at a residential academy at the Gwangju City, we have 6 additional cases, and we also have we are conducting our contact tracing, whether they are related to the door-to-door facilities there in the same city. Yesterday, we had 33 new imported cases, 1 from America, 6 from Europe, and 26 from Asia, excluding China, and specifically 15 from Kazakhstan, 3 from the Philippines, 3 from the Qatar, and 3 from Kyrgyzstan and also Uzbekistan. And the KCDC, we are also highlighting the fact that we are are having an increase of the local infections, especially centering around door-to-door facilities as well as PR centers that they operate. And in relation to these door-to-door facilities, these PR centers as well as training centers that they hold could also be very crowded and could take place on a very enclosed space. Therefore, we ask the middle-aged to the elderly citizens to refrain from going to these facilities. And recently, we also had a very small-scale information sessions that were held at households, and they carried out conversations in close contact environment, and therefore there were higher risks of infection. So we also ask you to refrain from going to such meetings. And if you have any suspicious symptoms, please refrain from going outdoors. Please cancel your gatherings and also visit a screening clinic to get tested as soon as possible. And the central headquarters here, we also witness that we have a surge in the number of cases related to the religious facilities. And starting from the 6 p.m. of July 10th, we also will be mandating these churches nationwide to keep to mandatory quarantine protocols. And these are the protocols that need to be followed by staff members of the church as well as the members. As for the staff members, aside from all of the regular services, all of the gatherings, events, and meals should be prohibited. And also they need to keep a track of all of the visitors, and they need to restrict the entry of anyone who has symptoms, and before and after the service they need to disinfect the area on a regular basis. And as for the members of the church, people are asked to refrain from engaging in chanting or singing or having conversations indoors, and they are banned from eating together and consuming food indoors, and they also need to wear face masks at all times. The KCDC also notes that starting from until April 30th, we have identified about 8,000 people who have been recovered and discharged, and we have some clinical analysis of their clinical data, and here are some findings. And out of them, 60% of them had been administered at hospitals, and 36% were administered at life treatment centers, while 2% were remaining at home. And in relation to their symptoms that they showed in the initial stages, people also had more than one symptoms. As for the hospitalized patients, they had 70% of them had such symptoms, and about 30% of the life treatment centers, they had those symptoms with above one symptoms. And also most of these patients had a cough as well as spectrum, and also they had fever. And the analysis of the data also shows that about 95% of them were in mild conditions, and about 9.1% of them needed oxygen treatment as well as critical treatment. And these severity of the conditions also exacerbated as for the people with clinical symptoms and also the chronic illnesses like diabetes and others. And as for those who have been administered in hospitals, we had about 94.1% of the people who were administered with the oxygen treatment. They had been removed of this treatment within the next 3 to 4 days. And most of the people who were in isolation at the life treatment centers, they were discharged following mild symptoms, and they did not, and only 7 patients out of them showed critical conditions that enabled them to be transported to a bigger hospital. And also about 23.3 days on average was the day for the period for the administering of the hospital. And also we have found that if we have an outbreak of influenza together with the COVID-19, we would have a burden of the medical capacity, and thus we will be providing more influenza vaccines to the wider public, and we have also allocated special budget. And currently, the free vaccine is available to those people under the age of 24 months, as well as those who are pregnant and the senior citizens. However, these will be expanded to include some of the students as well. So please take use of this free vaccine. And yesterday, the Korea statistics also released some data, including involving the foot traffic from the mobile phone usage. And it also saw that there has been an increase of the foot traffic of the public. Of course, it is very difficult for the members of the public to keep distancing as the COVID-19 outbreak becomes a prolonged one. However, we need to make it a new norm so that we need to make a safer environment for us all. For individuals, you need to reduce the risks of infection in your daily routines, and at multi-use facilities as well as businesses, these business establishments also need to continue to lower the risk of transmission and infection. Throughout today's briefing, we have been mentioning about some intensified quarantine for churches nationwide. And thanks to the participation from the religious circles, we were able to curb the wider spread of the virus. And we believe that these are the outcomes of the church members who participated in our measures. However, there were some small-scale group meetings as well as small churches that are prone to the infection. So we ask you to take a particular precaution. As for the senior citizens who are at the high-risk group of the virus, we ask you to refrain from going to these meetings and gatherings. And I understand that this is very difficult. However, please prohibit any gatherings, events, or meals aside from the regular services. And please comply with the core quarantine protocols to protect your lives. Thank you very much.
Right, there was Chung Eun-kyung, the head of KCDC, with Wednesday's afternoon briefing. She's called for more caution for religious practices.
Yes, she called for more caution, and also the government is implementing new measures, which will start on July 10th, which will be this Friday. So beginning on that day, smaller gatherings related to religious services will be banned, which means it does not regard official church services, for instance, but other smaller gatherings that are unofficial and which have been, the reason for these many of these new cluster infections. So these will be banned, and also the guidelines at official church gatherings should also be abided by, which means body temperature checks as well as no chanting and also no eating together. And also, according to Chung, there has been made some analyses at the government on people in quarantine and people that have been treated for the virus. It looks like 42% of some 8,000 patients showed symptoms of coughing when it comes to the coronavirus symptoms. And then according to Statistics Korea data, it looks like the foot traffic among Koreans has been increasing to the level of before the coronavirus, which is a concern because we should abide by basic social distancing measures. But I actually heard earlier this morning in a briefing that in the city of Gwangju, movement has been going down by around 30% recently after Gwangju upgraded its social distancing level to 2. So that's noticeable as well. And in the meantime, there has been an increase in imported cases, with 33 today and 11 detected at the airport. And many of these, again, came from the Asian region, including Kazakhstan.
All right, so thank you for that. We'll see you again tomorrow then.
See you tomorrow.
Meanwhile, transportation trends are changing amid COVID-19 as commuters claim that social distancing on public passenger vehicles remains a challenge. We have details in this next report.
The COVID-19 pandemic has changed our daily lives. Daily ridership on public transportation has plummeted due to the outbreak. The government has strengthened disease prevention measures by shortening subway operating hours since April and mandating the use of face masks on public transportation. Despite these measures, people are still hesitant to use public transportation.
밀폐된 공간이기도 하고 조금 좁은 공간이어가지고 좀 걱정이 많이 되고
아무리 마스크를 써도 지하철이나 버스는 사람들이 밀접되어 있고 또 이렇게 부딪히는 경우가 많기 때문에 조금 더 불편한 감이 없지 않아 있는 것 같습니다.
Amid mounting concerns, many citizens are avoiding the use of buses and subways in Seoul. Meanwhile, the government temporarily suspended its road space rationing scheme in an effort to curb the outbreak by allowing more people to drive their own vehicles. These government measures and public anxiety have led to an increase in the number of vehicles on the road and gridlock during commuting hours. But what about subways? Line 9 is the busiest subway line in Seoul, and noticeable changes can be observed when comparing what the subway trains looked like before and after COVID-19. Compared to the packed subway cars that were typical during commuting hours in 2018, there are now far less people on the trains following the outbreak of COVID-19. With work-from-home policies yet to fully settle into Korea's corporate culture, what's the most popular means of commuting for those heading to the office or back home? As the end of the workday approaches, people started gathering around public bicycles being rented out by the Seoul city government, and all the bikes were gone in no time.
요즘에 코로나 때문에 많이 불안하기도 하고 운동도 할 겸 이용하고 있어요.
자전거는 아무래도 이제 혼자 타는 거니까 대중교통 타는 거에 대해서 부담도 덜하고 걱정도 덜해서 많이 이용하는 것 같아요.
The Seoul metropolitan government announced that the number of total bike rentals were tallied at nearly 2.3 million in the February to March period, up 67% from last year. In addition, according to a local car-sharing company, an average of 21% more people used its services on a weekly basis compared to the previous month, which was also a 51% on-year rise, while an electric kickboard company says its number of users jumped 300% in June compared to February. COVID-19 is changing the way people commute, with more diverse options now available aside from public transportation.
The total number of COVID-19 cases in the U.S. now stands at over 3 million. And among the worst hit states is Florida, where officials set a national record for the most cases in a single day on July 4th, with 11,458 people testing positive. For more on the situation there, I have Lee Mi-young, a resident in Florida. Hello, Mi-young.
Hi, how are you?
Fine, thank you, Mi-young. Now, despite the alarming record of COVID-19 cases noted on the 4th of July in Florida, I understand crowds of people gathered to celebrate Independence Day last weekend. Please tell us more.
Yes, we've had gatherings at the beach. I live in Jacksonville Beach, and just like every other 4th of July, unfortunately, this year was quite different with the pandemic. However, we were abiding by social distancing. And there were monitoring police driving by on the beaches to ensure that the citizens were abiding by those guidelines.
Given the alarming numbers there, Mi-young, how is the general public response? So what is the general public response to the pandemic?
Well, I believe that Florida has a more lax guidelines in place, besides other states such as New York or northern states. And due to that, which is the reason why I believe that the number of corona cases has spiked. As you know, in June 26th, the bars were all completely shut down at one point due to the high increased numbers, which starting from June 29th started around 5,000 cases. And to your point, on the 4th, it spiked up to 11,000. So obviously, people are taking more precautions now, and only in Duval County did we start to be required to wear masks, and that was only about a week ago.
I see. What other measures are being taken by state authorities in Florida to perhaps better tackle the outbreak there?
Well, there are social distancing guidelines. A lot of the businesses are required to also have limited capacities, such as 50%, outdoor dining as well. And like I mentioned, all of the bars, which has more condensed gatherings, have been shut down as well. In addition, the social gathering numbers have been reduced to between 10 and 50. So I think those measures are the guidelines that the state has implemented.
What do you believe are some of the key differences, perhaps, in responding to COVID-19 between authorities there in Florida and their counterparts here in Korea, Myung?
Well, I believe that the timing, whereas in Korea, the government took pretty quick actions to not only test and contain, which obviously led to a much quicker, flattening of the curve. Unlike where in the United States, even though our first case was in January, we really didn't take full measures until, I would say, at least in Florida, things weren't shut down until about the beginning of March, which clearly, given those, the delay, which is 2 months, had a huge impact on the number of cases.
Right, Myung. Thank you for making the time to join us live at this hour with your thoughts.
Thank you.
(3월, 4월에) 유럽이나 미국이나 이런 해외에서 굉장히 많은 입국자들이 있었고 그때 유입됐던 그런 바이러스들이 최근에 유행을 주도하고 있다라고 현재는 해석을 하고 있는 그런 상황입니다.
Health authorities here have claimed that the spread of the virus has become faster in recent months compared to the earlier months of this year. What's more, a new variant with its origin in the US and Europe is now dominating domestic transmissions. For more on these fresh concerns, I have Dr. Kwak Young-hwan from the Suncheon University Hospital. Welcome back, Dr. Kwak.
Thank you.
And I also have Professor Lee Hoon-sang from Yonsei University. Welcome, Professor Lee.
Thank you for having me.
Professor Lee, the cities of Gwangju and Daejeon are seeing a disturbing rise in the number of COVID-19 cases in recent days. How do you assess the speed of the latest spread?
So in the current data about the replication value, we call R value. The R value currently in Chungcheong and Honam area is 1.34, which is a bit higher than 1.06 in the nationwide level. So it seems like there is somewhat of a faster spread of the virus. But at this point, it is, and there has been some suggestive research result that suggested that some of the recent virus variation tend to spread somewhat faster, but it has not been completely confirmed yet. But there can be some other factor as well about like how the disease had been controlled in that location, in the area. So, but as a result, we see somewhat of a faster spread. So still, I think we have to be watching it very carefully.
I see. Dr. Kwak, as I mentioned earlier at the start of this discussion, a new strain is currently dominating local infections here in Korea. It's called the GH strand, I believe. Can you tell us a bit more about the strands we have? Because I understand the GH comes from the S strain, is it?
So WHO currently has 7 different strains that they found out. They're laying out L, S, V, and some of the Gs, including GH and GR, and just general G. And they also include what's called O for others. We've had at least 5 out of the 7 that they mentioned so far, and some of them stand out more than the others because of the numbers of cases that they yielded. For instance, the number of S, which was the one that we started getting from Wuhan City, yielded about 33 people. And then we had strain V happen mostly in Daegu area, and that yielded about 127 people to my knowledge. And currently, we're going through the phase of GH. Well, I couldn't say phase, but it's more of a strain that we're getting so many of. And that's currently yielding at about 333 confirmed cases as of now. So it does seem like the newly strained that they are coming in from the overseas and much more spreading in Korea is somewhat more infective than the other strains. But we also have to keep in mind there was a drastic change in the measures that the government was taking, from the social distancing measures to daily life measures. It happened to coincide with that time frame. And also, many of these numbers started happening with the incident from the Itaewon Club incident. So we have to keep in mind we are still quite under control, mitigating the spread of the virus. It's just that we, not so much from the government maybe, but for us as citizens, better take care for ourselves at this moment, I think.
Right. Professor Yi, what are the chances of further mutations?
So the coronavirus, which is called the SARS-CoV-2 virus, is RNA virus. So currently, GH type is actually quite prevalent in Korea right now. But because it is RNA-based virus, it has higher chance of mutating because it is less stable than DNA type of virus. And especially in the process of self-replication, it has a weaker mechanism of self-correcting those mutation errors, the replication errors. So that's why we are seeing more chance of the mutation. So I think as the virus spreads more, which means infecting more people and infecting more cells, in that process, there can be some chance that it can mutate further.
I see. Dr. Kwak, given that reality, does the mutation of the virus require a change on our part in our handling of COVID-19 or response to this pandemic?
Right. I'm going to start out by saying no, simple no to that question, because overall, we have been taking the same measurements and same regulations all along. We've had all along a very strict regulations compared to many other countries who are hit with the same strain of mutant RNAs. They had much lenient measurements. Let's say, for instance, if we look at the United States or many of the European countries that are currently containing the same strains of RNAs, they're lacking masks. They're not prohibiting the gathering of people more than 50. So we've had a very strict control all along, and we just went a little lenient on that, but we're still very tight on the regulations that we're currently keeping. So I don't think we need to really differentiate the treatment method or even the governmental regulations per se. I think it's more up to how we are going to take it from now on as citizens. The regulation could possibly stay the same, maybe a little changes in the specifics, but more so, we need to realize that, social distancing is really important. Keeping hygienic measures is really important. So we should wash hands more, we should open the windows more, we should also wear the mask at all times.
Right. Professor Yi, what impact do mutations have on efforts to search for a vaccine or cure?
So especially in terms of the vaccine, there can be some difficulty that can be expected because some of the vaccine that targets a certain protein particle in the virus, because if the virus mutates, maybe actually the preventable aspect of the virus, the efficacy of the vaccine might be compromised. But I think because there is the virus, the vaccine development is currently ongoing. I think the virus developer can respond to that mutation. But I think we have to watch out that the efficacy can be compromised because of the mutations. And also, depending on the treatment, depending on the medication, the drugs that are developed, if it is targeting certain part of the virus in terms of drugs developed, then there can be some difficulties as well. But overall, I think the current drugs development are still ongoing, so we have to see.
I see. Dr. Kwak, more than 200 experts from more than 30 nations, I believe, called on the World Health Organization to recognize evidence that proves COVID-19 is an airborne disease. Now, quite recently, the WHO has acknowledged emerging evidence that shows, yes, COVID-19 can be transmitted through the air. What implications does this latest development have?
Well, I'm going to give you a very funny answer to that too, actually. Not much for us, because it doesn't change the regulations or the measurements that we're currently taking. Maybe for others in other countries, yes. Even from the beginning of the whole pandemic, let's say if we go back to the not history, but the beginning of the year when it first started in Wuhan, we were getting news from China that people were getting infected just by living in the same apartment and just by sharing the same spaces. Now, as time passed on, it was more likely that the virus is passing through people contacts rather than just space sharing. But there were some occasional incidents where people were actually found to be transmitted just through sharing of spaces. So what does that mean to us? It means that virus is still there, and we still need to be careful. There is that chance that it can get transmitted through just by sharing space, but does that change the regulation? Not so much, because the regulation is currently under taking control of space sharing anyways. So for us, it's and I again have to emphasize again, whether it be the droplets or whether it be airborne aerosols, it doesn't mean that we have to do anything differently. It's more of so we need to be careful by minimizing human contacts, minimizing people gathering, and also minimizing sharing foods and sharing spaces.
Right. Well, Professor Yi, as Dr. Kwak has mentioned, I do believe that Korea from the start treated COVID-19 as an airborne disease, which is why health authorities place much emphasis on the wearing of face masks. And if memory serves me right, I do believe health officials also calling for the wearing of face masks in air-conditioned indoor spaces if ventilation is not possible. So do you suppose this is the reason why Korea's containment efforts of COVID-19 were relatively more successful than those of their partners elsewhere around the world?
I certainly think so. Korea's response had been somewhat more aggressive than other countries, especially in terms of mask and reducing social gathering. I think even though right now the currently known airborne transmission are happening only with some of the measles and tuberculosis and smallpox and some other diseases, but I think it is a little bit early to confirm that airborne transmission is possible with the COVID-19. But given the current measure, there is quite a strict in Korea. I think current Korea's approach had been quite successful, and I think one of the current needs that we have to do is stick to current approach that we are taking for the prevention measure.
Right. Dr. Kwak, going back to the GH strain, just the word mutation itself holds so much negative connotation. I was wondering, are our current efforts to deal with the virus enough, or should we be perhaps enforcing more safety precautions to keep that virus at bay? Because I do understand that that is the virus that we are currently witnessing in Gwangju, and that was also the virus we noted in the Seoul Itaewon district outbreak. What are your thoughts?
So I'm going to go into a little bit more details about how the GH strain differs from the others. How they tell the infectivity of each strain is by going into the labs, having all these strains infected cells and see how that spreads to the other cells that are connected. And apparently the GH strain happened to spread much faster than the other cells, about 6 to 9 times as much. So it does tell us theoretically that it can spread very quickly, and also among people the transmission can happen very quickly. It does not necessarily necessitate for the government to change their control plan, though, because it still means that it's going to transmit in a same fashion. It's still going to transmit in a people gathering. It's still going to transmit in a shared confined space. It's still going to spread through, let's say, saliva or human droplets. So from the perspective of the government control, we are in a very strict control already. Not much to be changed there, but maybe more effort could be made so that the citizens are more aware of the direness of this condition right now, that people can recognize the severity of what's happening and start to wear more masks and not gather so much.
Right. Dr. Kwak, in neighboring China, researchers there found a new swine flu strain with pandemic potential. They've also issued a health warning after a suspected case of bubonic plague in Inner Mongolia. What do you believe is the reason, Professor Lee, of such sporadic outbreaks of disease in China?
I mean, because maybe, first of all, China has more people that has most of the population than any other countries. So it just increased the chances. Another aspect is maybe the close proximity between the animal and human, and like many of the poultry or some of the industry that consumes wild animals. So maybe that can play factors as well. So I think right now, I think there had been some of the calls to reduce wild animal trade and wild animal consumptions. But that kind of a proximity of the human and animal is happening in other countries as well. So I'm not sure if you can say if China is doing worse than other countries, but in general precautions, the consumption of the wild animals and keeping the wild animal consumption industry can be, I think, somewhat dangerous compared to other industries.
Right. All right, Professor Lee, thank you very much for your thoughts. And Dr. Kwok, as always, thank you for being with us today.
Thank you.
Right, well, that ends our coverage for this Wednesday. Tomorrow, we take a new look at the economic consequences of the pandemic here in Korea. In the meantime, do share your thoughts and inquiries with us through our social media accounts or homepage, arirang.com. Thank you for being with us.